Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we are talking about high blood pressure that affects 1 in every 4 people. Let's get now to some of our viewer questions on this issue. Patricia from Chalanpago asks, I was recently diagnosed with having high blood pressure. What lifestyle changes do I need to make? And we talked about this earlier.
That's great. Yeah, Patricia. Cut out your salt, no added salt in your cooking, and try to not put any salt in your food at all. Then we want you to exercise. If you're overweight, please lose at least 10% of your body weight so that you get closer to your target. As far as other lifestyle measures, some meditation or yoga or breathing exercises can help reduce your stress and help you that way. And I think aside from that, if that hasn't helped, then you'll have to face the fact that you need to be on medication. And I think people are quite often very afraid to be on medication. They often ask me, do I have to be on this forever? The answer is probably yes. But it's going to save your life or extend it at least, and I think that's really an important thing. Most of the time people worry about side effects of medicine, that it's very safe. There have been, there are dozens and dozens of blood pressure medicines out there, and there'll be one that fits you.
Okay. Dale from Barragata asks, why do smokers tend to have higher blood pressure than others?
Great question, Dale. So when you smoke, you're inhaling a lot of smoke and less oxygen, and so your heart is not getting as much oxygen. That's one thing. And it also creates constriction of your arteries. So there's like a tighter artery that your heart has to pump against. So those are the 2 ways that smoking affects your blood pressure.
Cynthia from PD asks, how much do I need to exercise to help lower my blood pressure?
The more the better, but we'll say 30 minutes at least 4 times a week, please.
Okay. Linda from Jigo asks, I work in a very stressful environment, which has resulted in me having high blood pressure. How can I help to alleviate some of the stress in a fast-paced job?
Yeah, that's a really hard question, isn't it, really? So I think if it's a situation like that, then there's a way to look at it. Either you're going to change the environment or you're going to change yourself. If you can't change the environment, maybe you need a different environment, But you can always change yourself. You can always change your attitude in that job. And the easiest way to change it is through gratitude, of expressing gratitude. I'm so thankful I have this job. I'm so thankful I don't have a worse job. I'm so thankful that all the other things that I have in this job are working out. And maybe seeking support from the colleagues, and then changing yourself actually in your own body by eating more healthfully, exercising, and then you're able to cope with the stresses at work in a much more healthy way. I hope that helps.
Okay, good advice. Norman from Tammany asks, are there any natural remedies for high blood pressure rather than taking medication?
Yeah. I think the best natural remedy would be weight loss, cutting down on your salt, and of course potassium also can be very helpful. So bananas or orange juice can also be a good source of potassium. That can help lower it. But remember, this is something that's genetic. All animals, almost all animals anyway, will have a higher blood pressure as they age. It's a disease of aging, and it's a disease of lifestyle. So if you can have the best lifestyle possible, you're still going to get older, and your blood pressure will still get higher, particularly if you have a family history of it. So in that case, you may need to end up being on medication. Again, not being fearful of it, understanding that it's there to help you, not harm you.
Okay, and our last question, if I can read this out. Vera from Dededo asks, is it true that vitamin C supplements can help reduce high blood pressure?
Yes, and that's true. That's something natural that you can do. If you take 500 milligrams of vitamin C, that is shown now to reduce your blood pressure a little bit. So harmless and a little bit helpful.
Are there any sorts of foods you keep mentioning, staying away from our favorites like the soy sauce on the rice and the fenadini? But are there any types of foods that may be more helpful than others?
I think mostly green leafy vegetables would be very helpful, and avoiding greasy, fatty foods. See, because the blood pressure is one risk factor for heart disease. It's a strong one. And then we talked about cholesterol and smoking and diabetes. So the more you can do to cut down on your risk factors, the likelier you will have a healthier heart.
Okay, sounds good. Doc, any last words of advice for our viewers?
As you mentioned, please get your blood pressure checked and don't ignore it. If it's high already, make sure that you're on medication. National guidelines say that if you're blood pressure is already in the second phase, meaning 160 over 100 and higher, you need at least 2 blood pressure medicines, if not 3. That's a very common scenario that I see people coming in underdosed. They're only taking a small dose of only 1 medicine, and that is not even touching them. So make sure that your blood pressure is at target.
And before you get it checked, and I had a friend that did this, he got his blood pressure checked after a night of drinking and smoking.
Yeah.
And it was really high.
Yeah, true
So,
story.
you know, you need to prepare yourself before you get it done.
That's true, and of course smoking and drinking are unhealthy, and we shouldn't do those things to excess, definitely. And one last thing would be white coat syndrome. People say, oh, I always have high blood pressure when I go to the clinic. At home I'm fine. That's great. If you're fine at home, that's what matters. But do check it at home at least.
Okay, Doc, thanks so much for coming in. Don't forget to lower high blood pressure. You need to exercise, start eating healthy, and cut back on the stress in your life. All things I need to do. Dr. Lom will return next week when we are talking about the big G. We're talking about gout. Send us your questions to healthyliving@KUAM.com. Post a question on our Facebook page or, of course, on our website. There's more still to come. Stay with us.